Thank you, Mr. Chairman. I want to thank both you and the ranking member for your collaborative efforts to raise this issue today. I want to start off by talking about a couple in my district. They are 73 and 74 years old, respectively, and they are stretched every single month to cover their expenses. The wife is diabetic, and she has a number of medical conditions, and for 2016 will probably lead to an out-of-pocket prescription price tag of around $4,600. Her husband's out-of-pocket expenses for prescriptions are going to be about $1,900 a year. Now, since they've retired, they are seriously anxious about their finances. How are they going to continue to afford to pay for their health care? And get this, the wife feels endlessly guilty because her medications are the most expensive. And even with some coverage, they together face overwhelming pressure of having to manage the family's budget, which after medical expenses is only about $20,000 a year. This is to pay their home loan, property taxes, as well as food and utilities. This is a crisis that is far too common across the country. And when I hear about stories like this from my constituents in the 8th Congressional District, and then I hear about $200,000 bonuses for executives in a pharmaceutical company that purposefully shut down distribution of a life-saving drug so that they could make that money, it disgusts me. It is absolutely disgusting. You know, and the Valeant and Turing witnesses have testified today, have used many different tactics to downplay the harmful effects of their price increases. They want to shift the blame, and they want to shift the attention and say that, oh, the patient population is so small that the price increases doesn't affect the larger healthcare system. And individuals that they pay on the more mainstream drugs, you're not being affected. It's just those 3,000 people, because there's only a few of them. And that it's actually the large insurance companies and not individual patients that bear this burden. But let me tell you, every one of us pay those insurance companies. My entire office is in Obamacare. We pay those insurance companies. So this hearing has really shown that this is hardly the case. And Ms. Retlaff, isn't it true that Turing's price increase led to astronomically higher copays for many of your privately insured patients?
Yes, it did, but through our copay program, we capped them at $10.
Really?
Yes, that's true.
Well, you know, your internal memo identified that, you know, one patient had an insurance copay raise up to 50% increase to $16,000, and others have copays ranging from $1,000 to $6,000.
Correct.
Ms. Retlaff, isn't it true that some doctors treating patients in hospital settings were forced to switch to secondary alternatives therapies because they could not access Daraprim?
I suppose that's true, but in response to that, we have discounted Daraprim by 50% and introduced a smaller bottle to better meet their needs, and that seems to have resolved the issue.
Well, you know, the doctors are saying that they had to switch, and it was not their preference for what they would treat their patients.
Again, in the hospital setting, we're offering discounts now so Daraprim can be available for those patients.
Can you confirm that before Turing owned Daraprim, it was widely available, covered by most insurance, and affordable? Before you owned it?
Yes, it was covered by most insurance. I don't know what you mean by widely available.
Okay. Mrs. Schiller, isn't it true that your price increases on Isopril and Nitropress have cut into hospital budgets?
Yes, it certainly would have cut into their budgets. The price increases were meant to stay underneath the reimbursements for the bundled rates, but it would have certainly hit their budgets.
Yeah, it absolutely did. In fact, at Johns Hopkins Hospital, their chief pharmacy officer in Baltimore said, these expenses deplete importing savings and result in less funding for research programs and technologies that improve care. This is Daniel Ashby, and he further says that the high cost threatens patients' access to critical treatments and create financial burdens on low and middle income patients. Mr. Schiller, these are only two of the many drugs your company owns and has increased the price of. Is that correct?
That is correct.
How many other drugs have you increased the price of?
I don't know offhand, but
so you have so many that you don't even know how many other drugs you've jacked up the prices on everyday, hardworking Americans who are suffering from diseases. I mean, that boggles me. You're coming to testify before Congress, and you don't even know how badly you've socked it to the American public.
We have 1,800 products around the world,
Okay.
We certainly raised the price on some, and a number that you all have mentioned. We've acknowledged mistakes. We've also acknowledged that going forward, it would no longer be looking for those opportunities to purchase these older drugs. When I took over at the beginning of this year, we froze all price increases.
Have you returned the price increases back to where they were before you raised them? That's the important question.
Well,
I yield back, Mr. Chairman.